Welcome everyone to How Foundation's Brain Health Week. We are very honored to have with us today Dr. Daphne Denham, a general surgeon who has a practice in Chicago, Northbrook, Illinois actually, and also in Fargo, North Dakota. Dr. Denham, we're so happy you're here and looking forward to our conversation today. To start out with, can you tell us a little bit about what it is exactly that you do and how you got interested in working with hyperbaric oxygen therapy? I know you're a general surgeon, but you have experience with HVOD as well.
So right now I run the clinic in Fargo full time. Okay. And if I can throw a plug out for anyone in North Dakota that wants to join me, we're actively looking for a partner. But our focus of the clinic is wound care and hyperbaric medicine. And in Fargo, we have had the luxury of getting the word out about how well hyperbaric works for traumatic brain injuries. My passion is acute concussions. Patients who have had a head injury and we can get them treated in less than 7 days from their injury. That's what I've been working on for 3.5 years now, and our results are incredible. I'm hoping that we are going to be able to change the standard of care and make hyperbaric treatments after a concussion of any severity within the first week become the true treatment instead of the wait and see approach. Because what we are seeing is an average of only 3 treatments is needed, and we are not seeing the long-term post-concussive syndrome sequela. And what's even more exciting, but will take years and thousands of patients to demonstrate, but we are not seeing the students come back with subsequent concussions. So it seems as though we're able to somewhat prevent that increased risk that we all know subsequent, or once a patient has had a concussion, they're much more prone to the subsequent concussion.
That's fabulous. That is fabulous. So you're treating, just to paraphrase, I'm sorry, I just want to make sure everybody catches this, who are, people who are new to this whole idea or way of treating concussions. So you have been treating concussions that happened 7 days or less ago, and treating them in an average of 3 HVOD sessions, as opposed to the protocol, the standard protocol that most everyone that I've ever heard of, including the top-notch facility that we work with, has said uses a standard of 40 sessions to treat concussions.
Well, so, we're talking about 2 different things. What they're treating with 40 is patients who have post-concussive syndrome, who are months out from their injury. And my thought is, my original thought when I thought of this years ago, watching my daughter's volleyball team, and how many players were out with concussions is, wow, what if we took them right away and did hyperbaric instead of this wait and see approach? So our approach is an aggressive treat everyone versus a wait and see who's going to have problems and then need all of those subsequent treatments. And when I first started, I wasn't sure how many treatments everyone would need. So it's been incredible to be able to see that on average patients only need 3 treatments. Looking at our data here in Fargo, since September the 1st, we have treated 104 acute concussions. 95% of those fall in a bell-shaped curve between 1 and 7 treatments, with the majority needing 3 treatments, and our average is right at 3. We do have a few outliers, 2 patients required 9 treatments, 2 patients required 10 treatments, and 1 patient required 15 treatments. But it's impressive, the bell-shaped curve of right around 3 treatments is needed.
I see.
So what that door has opened is we now have a private insurance company that is interested in looking at this from a pilot program standpoint. We know that private insurance spends millions of dollars on what we call the mild or just concussion head injuries. And if we can save them money, then obviously they're going to be more interested. And we should be able to demonstrate not only are we saving them thousands of dollars, potentially even per patient, but we are dramatically improving the quality of life of these students. These students are able to go back to school on average in less than a week.
Wow.
And with the right eye device that we have, which is now FDA approved as a concussion treatment, we're able to show that their eye-brain function has returned to normal. What we know is after a concussion, they can see with this eye, they can see with this eye, but when they try to track, instead of tracking to one point and the same word and able to read, they're either cross-eyed or they're exo and see double vision. And even the CDC report from last year demonstrated that 14% of children who have had a mild traumatic brain injury, which is what we call concussion, still need academic assistance at a year.
No kidding, a year?
So we're able to show that these patients, when treated aggressively, treated up front, whether they need treatment or not, because that's been some of the criticism to me is you're over-treating patients. Well, we're over-treating with pure oxygen. So I really don't have a problem with that.
Yeah, and it's going to
save. They're saying that we're treating patients that we're going to go on to recover anyway. But an article came out in September, and what the gist of the article was to come up with a better tool to inform parents in the emergency room as to which students were more at risk of a prolonged recovery. And with that, I believe it was over 100, maybe 141 patients in a Boston hospital who presented within 10 days of their concussion. 58% of those patients still had symptoms at 4 weeks. So when concussion physicians tell me we're treating patients who would resolve their concussion on their own, and that 90% of patients resolve their concussion within 10 days, you know, we're clearly not asking the right questions. Are they within 10 days able to go to school? Maybe. And are we saying that they're better? Probably. But are they able to read and perform academically and perform athletically at the same level that they were pre-concussion? Probably not. But what we're demonstrating is after we treat them, again with an average of just 3 treatments, they are able to go back to their pre-concussion function, both academically, to me, which is the most important, but then also athletically. And I have a wonderful son that left to his own devices, dislocated his hip this weekend.
Playing a sport.
I have always said that my dear child is much safer on the ice in all of his protective gear than he is left to his own devices.
I know.
So I'm not someone that's on the bandwagon to say we've got to do away with contact sports.
Right. They're great.
I love that children are part of a team. I love that children are physically fit. I love that they have practice 2 times a week and games on weekends.
Mhm.
And they learn time management skills, and they learn priorities, and they learn
Yes.
to leave it on the field, something I wish I had learned years ago.
Right.
So
How to lose.
I want to swing the pendulum away from concussions are bad. We've got to take away every sport that causes them
Right.
and swing it to concussions are bad. The
Mhm.
brain needs oxygen.
Yeah.
We have a very good way to deliver that oxygen.
Mhm.
Let's use it.
Right.
And let's find a way to do it cost effectively
Mhm.
so that it is affordable for everyone.
Right. Exactly. Now, okay, what happens if you treated one of these young people and then they go back to their sports, conceivably in a little more than a week? Did you say they can start playing
Some
again?
can, yes.
Yeah. Okay. And also they're, doing their studies with tests and all of that. They're doing fine. And then whether on the field or, whatever, they get another concussion. And we know, that second or third subsequent concussions can be the most dangerous or the most dangerous. How does that affect the student at that point after they've been healed and treated with 3 sessions for their first concussion?
We had a baseball player who had his second concussion, came in and was treated, did fine. I forget how many treatments, 3 or 4 treatments. Almost a year to the day, he was hit again playing baseball with a ball going 75 miles an hour. I've seen the video clip from his mom. His helmet was knocked off. He was knocked completely down. His mom called that day. We got him into the clinic the next day, and we treated him. And he did not need any more than 3 treatments that time. And that was even a year ago since. And that was in the clinic in Northbrook. So I don't know if he got hit a year again this year. But the point is,
that was his third concussion, and he was able
that was his third concussion, and within 3 or 4 days, he was right back out there.
Was he
and I've treated
returned to his original baseline for academics
Correct.
and all the physical signs? That's
One
amazing.
of our best success stories is a soccer player whose first concussion was debilitating. He was academically not able to be his previous pre-concussed self for 6 months, and we treated him for 2 weeks because he was post-concussive. It was 2 weeks until he was back to better. That was in a summer, and that following spring, he decided to try out for another sport, not soccer, but he tried out for a different sport. In practice, he was hit with a ball, which obviously scared him, so he came in for a treatment, and he was fine.
Okay,
and
so
then
treatment.
Several months later, he was hit again, and again, he didn't even develop symptoms. He was concerned from the hit and came in and had another treatment. I believe he even had 2 treatments that time, and that was in August. And he is now graduating with honors.
Fabulous.
Scored off the top on the ACT and is living his academic dream. So as long as we treat these concussions, it does not seem to matter that it was the second concussion or the third or the fourth. They're not going on to have these post-concussive symptoms. And I'm hoping we will show that of all of the kids we see and we treat their first concussion, that compared to the national average, they are less likely to have subsequent concussions. We do know from a study with the NCAA that of football players who returned to play after a concussion during the same season, I think it was 30-something% were out again with another concussion just in that season alone.
Wow.
And so often, many of our patients come in and they'll say, I first got a concussion in basketball, and then I slipped and fell on the ice, or I was in a car accident, or I hit the kitchen counter.
Yeah. Right.
Many of their subsequent concussions are not always related to their contact sport. And many of those subsequent concussions, the hit that it took to cause that concussion does not make sense with the extent of injury. So we know that the brain was primed, and that's why their concussion was much worse with the subsequent concussions. And again, that's what we're not seeing when we treat patients, and that's incredibly exciting.
Right. So do you feel that after being treated for a concussion with hyperbaric oxygen therapy, that the brain, can I say, is protected in the case or inevitability of another concussion?
I wouldn't say protected. What I would like to say, and I can't say it until we have even more data, but what I'm hoping we will be able to say is that the brain is back to its baseline.
I see. So it would be as if it never had a concussion before.
That's what I'm hoping that the data will pan out. In laboratory animals, they take a biopsy and show that, but we're obviously never going to take brain biopsies, but that's what we'll need thousands of data points to suggest.
Yes, I see. Now, do you think, you've mentioned a variety of sports that are, played in middle school, high school, college, professionally. What about equestrians? What about jockeys? What about riders? Competitive jumping, even dressage if they fall off the horse or something happens, polo players. Have you ever worked with any of those? And do you think that hyperbarics would work as well for them?
I think hyperbaric will work as well for not only equestrians, but all concussions, after a car accident, after a slip and a fall on the ice with adults, after an injury at work that patients have a concussion. There are an estimated 3 million concussions diagnosed each year. I don't see a limitation to who can and can't have hyperbaric for their concussion, as long as they are healthy enough to have hyperbaric therapy. And we know the risk of hyperbaric are extremely low. Looking at, I think it was close to 400,000 treatments in a 2-year period of time, one of the wound management companies found that there was a complication rate of 0.5%. So 0.5% of almost 500,000 treatments. And if you look at that, the patients they were treating were the patients who've had radiation from head and neck cancer or diabetic foot ulcers, who may be on dialysis. They were treating a much higher risk patient population and still found this incredibly low complication rate. So no hyperbaric is safe. It's an extremely safe procedure as long as we're diligent and make sure that we respect what we're doing. We respect we're using 100% oxygen. Patients are going under pressure. The biggest issue we find is that patients have trouble clearing their ears, like flying on an airplane. And that's simply working with the technician, making sure they don't have a cold, that they know how to clear their ears, etc.
Yes, that's what they do here at the hyperbaric services. They give them a little sippy cup, which helps them clear their ears. Can you explain the mechanics of hyperbaric oxygen therapy? Exactly how does it work? How does it heal a concussion?
So I put it basically into 4 categories. First and foremost, hyperbaric oxygen hyperoxygenates the tissue. So when we're talking about the brain cells use an enormous amount of oxygen just as a baseline. So when brain cells are injured, it's difficult to get that enormous amount of oxygen plus enough to heal the injury. So usually instead of their baseline plus to heal the injury, they're actually below what they were getting before. And I often say it's as if you had a drastic pay cut and you've got to learn to live on ramen noodles and water. When we increase the oxygen that's dissolved, then that oxygen can travel much farther out from the blood vessels and can actually get into that damaged tissue and can raise the level of oxygen in that damaged tissue so that damaged tissue can repair and go back to normal function. Part of the reason, so that's first and foremost, is hyperoxygenate to get it back to normal level, to repair those cells.
Okay.
Part of the reason you get less oxygen is because there's so much tissue swelling. Right. And we know from hyperbaric that we can decrease tissue swelling by 20 to 30%. So if we get rid of the swelling, then our oxygen delivery is back to baseline. So if we can heal the cells and they no longer need even more, they're okay with just what they were used to, and we can deliver oxygen back to what they were used to, then we've been able to reset. The third thing that I'm fascinated about, which is why we talk about one concussion making you more prone to the next and to the next, is that a concussion turns on an inflammatory response in the brain. To the high school students, I say it's as if you have an aggressive hall monitor that's going through, citing you for every small infraction. The inflammatory process in the brain is overworked. It's taking oxygen to keep that inflammatory process going, but it's also every little thing, it's firing even more. So when a student who doesn't have enough oxygen to these cells tries to eat lunch in the school cafeteria, and all of the extra sensory and motor and vision and hearing input, then when the brain cells really need more oxygen and they're down here, they've turned on all of that inflammation, which is why that student is like, oh, I can't take it anymore, and has to go to a room and completely shut down to not have any sensory input so that it can repay the debt of the brain. And as I kind of sometimes laugh and say, not only do you not have the money, but you overspent. So now you've got to pay the interest charges and the overdraft charges before you can go back out and spend money again. So they really have to recover from that inflammatory process that they turned on in doing too much activity. But we know from rat brains that the inflammatory process is turned off with hyperbaric oxygen.
I see.
So we hyperoxygenate, decrease the swelling, and we turn off the inflammation. And then in the chronic brain injuries, we regrow blood vessels. So if they couldn't get enough oxygen because they're scarring and their blood vessels aren't open, by regrowing enough blood vessels, then we get back up to what those brain cells require on a daily, hourly, minute by minute, second by second basis of oxygen delivery. So those are the 4 things that hyperbaric does for brain injuries.
Now, where do stem cells come into play with that? Because I've heard that hyperbaric oxygen therapy makes the brain, the body, produce its own stem cells. So are those stem cells helping to grow the blood vessels?
Exactly.
Okay.
And there's some evidence out of the study in Israel with the stroke patients that the stem cells help to make new pathways around the stroke injury. But again, my focus is the acute concussions, the less than a week from injury. So really, those patients shouldn't need stem cells as much.
Right.
And with 3 treatments, we're not getting the high level of stem cells that 10 hyperbaric treatments has shown to deliver. So stem cells are extremely important in the post-concussive, in the post-stroke, and some of the longer-term injuries.
I see. Okay. Can you give me a couple, have you ever worked with a chronic concussion, say someone that, a student athlete that was, received concussions in, say, middle school, high school, college, and then have you ever worked with them years later, or, you know, an adult pro player who might have had the same experience, and how did that work out, and how did you treat them? What was their outcome?
We've had all of the above, and they've worked out very well. We had the pleasure of treating a young lady who was in a severe car accident 11 years ago. She was able to learn to walk again, to talk again, to basically be close to normal function again, but she had daily migraines and was only able to work 4 hours, and after 4 hours the sensory input was too much and she had to go home and completely shut down. After 10 treatments for her, she is dramatically better and says as close to her old self as she would think that she would be. Of course, she was so young when she had the accident. She's not having migraines. She's not too fatigued after working 4 hours. And she recently saw her optometrist, who did not know she was doing hyperbaric oxygen, and he did an eye exam on her, and she was laughing. And she said he did it, and he said, let me redo that. And she was very nervous. She thought there had been a problem, so he redid it, and she said, no, okay, tell me what's wrong. And he said, no, I cannot believe how much better your 2 eyes are functioning. After all the years that I have known you, what have you done? And she explained, well, I've done hyperbaric oxygen. And so often the eyes really are an incredible way to show how someone who's had a concussion before, whether it was within 7 days or years ago, how their brain and eyes are functioning together is what I call the canary in the coal mine. It's able to show some evidence of persistent brain dysfunction. And so many patients who were injured years ago forgot what it was like to be their previous self. And everyone says, you know, adjust to your new normal. And when we show them their eye tests and they're able to say, oh my gosh, I knew something was wrong, but everybody said, you look fine, just go back to life, you know, this is it, adjust to your new normal. Unfortunately, that's where the suicides come in. And just today, a friend sent me that the Olympic cyclist,
that Kelly Caitlin
committed suicide in her dorm room at Stanford.
Right.
She suffered a concussion in December.
Yep.
And her first suicide attempt was in January.
Right.
And in the article in the Washington Post, she was not able to perform academically as she was prior, was not able to see that there was hope for the future.
Yeah, she was depressed.
And she committed suicide. And her father states that she was never herself, never his same Kelly after her concussion.
Right.
And that's why we do what we do. We want everyone back to his or her baseline. Right. And so often concussions are a silent killer. Yeah. Patients look fine. They may have been very smart to begin with and are able to relatively function, but they're not at the level that they were before. And that's frustrating to them. I mean, for someone to be a student at Stanford there's not much room for you to only function at half as good as you used to be.
That's an incredibly high baseline, and to be a championship cyclist at the same time. And what could she be, 20 years from now? Or, what could a young man in the same position be 20 years from now if they were able to heal their concussions?
That's why what we're doing, I say, is keeping these student athletes, keeping these overachievers, even if it's theater or, they don't all have to be athletes, but keeping our students at their genetic ability and keeping them healthy, brain healthy, not depressed, not suicidal, not personality changes, not sleeping dysfunction. Getting them to be pre-concussed baseline.
Right. And I'm thinking about the veterans.
What we're doing.
Yes, exactly. I'm thinking about the veterans that we've treated, been able to help get treated here through Howe Foundation. And I'm sure have you worked with veterans before with concussions and post-traumatic stress?
Absolutely. And it's incredible what these men and women sign up to do for us.
Right.
And to be able to help them when they return be back to what they were. And I get so frustrated hearing physicians say, well, she started drinking and turned to drugs. Well, she's smarter than the physicians who keep giving her these drugs that make her feel worse, and she's in control of her own medication. Why would anyone who went through basic training, who signed up and went overseas to fight for our country, why would their core being be happy sitting on the couch collecting a disability check?
Exactly.
We're stupid. We
Yeah.
are stupid to not recognize that is not the person that we willingly shipped over to defend our country.
Right.
We shipped over an overachiever.
Yes, exactly. With incredible training.
And they're not happy not being able to function.
Yeah, exactly. It's the same thing as the high functioning students and athletes. They're really super people. They're the best of all of us. And we need to take care of them and help them get better so that they can go on to have the future that they were born to have.
If you want to make America great again, then make Americans brain healthy.
Yeah, that's right. That's a good slogan. Yeah, it really comes down to that, right? Because you can look perfect, as one of our clients had said. She was a D1 athlete, and after her 2 concussions, and she had migraines every single day for 3.5 years. I do not know how she functioned and kept going. She had to move home with her parents, and she had to wear a white towel around her head as a band-aid to remind her parents that she wasn't okay. And they couldn't just yell for her from the other side of the house. She'd get upset or tap her on the shoulder. It's an invisible wound, and it's not just about how you look. It's about what's going on inside and how to fix that, right?
Right. We have had many patients, when we show them their eye data, show them objectively, you are not functioning like you should, that are in tears, that are so relieved that someone is able to say, you aren't okay.
Right.
And especially when they know that they can get help. And so often the eye improvement is dramatic with just a few treatments using the stepwise protocol that we have.
Right, because these are often the most courageous, kind of toughest, people of all ages, the athletes, the veterans, and they're trained just to suck it up, not to complain, keep going, push through. So there's a lot of denial too. And I think I've heard this week, and I heard you say it too, that the brain does not self-report, meaning that sometimes they might not even be aware that there's a brain injury. There's something wrong in their brain. They think it's them, or, something bad is happening. But
Correct.
it is.
Correct. And I have 6 children, and they are extremely athletic. And there is no way they are going to let an injury get in the way.
Right. Yeah.
But especially when it's a brain injury,
right.
The brain does not say, hold on, I'm really injured.
Yeah. Mm-hmm. So you've seen with your own children, I mean, they've had concussions from sports, and you've seen them heal. And
one of my daughters had a concussion in January of 2016, and we had started some concussion work, but it was due to her concussion that I manipulated and came up with the protocol that we use today.
Wow.
So it was one of those, if you don't believe in everything for a reason. But when she came in, she was fetal position, laying perfectly still on the hyperbaric stretcher. We started her treatment. We developed this protocol because she was not getting better, but she was less than 24 hours out from her concussion. She rolls over and she says, okay, Mom, how much longer do I have to be in here? I feel better now.
Oh,
so she went from perfectly still, which is not that child of mine at all. That child of mine is a fidget queen and is never still.
Yeah.
So once she felt better, she touched the glass, she rocked the stretcher, she was truly better. And now 3 years later, we're seeing that played out over and over and over daily in the office. And it's incredibly rewarding, especially when Mom or Dad is sitting beside the chamber and can watch their child come back to life, so to speak. These kids come in and the lights are on, but nobody's home, and they walk like, every step, please, my head hurts.
Yeah.
And once we're finished with the first treatment, so often they may not be totally better after the first treatment, but so often it is such a dramatic difference, especially when we get them within the first week, that the kids are just like, okay, it's 9 o'clock and I can go eat and still make it to English class, and can I go to practice this afternoon? And they're back to themselves instead of tucked away in a dark room and then tortured to be pushed back to school early because now that's what people are recommending, which I disagree with. I don't think these kids need the cognitive challenge to their brains until their brains have been reoxygenated.
I see.
That cognitive challenge is going to take oxygen away from the injury and use it for the cognitive challenge. I'm fine with them walking around the block.
Yeah.
When a child breaks his leg, he can read a book, but he can't walk around the block.
Right.
When a child has an injured brain, he should be able to walk around the block, but he shouldn't be forced to quickly read a book until his injury is better.
I see. But if it's oxygenated, if he has hyperbarics, then are you okay with him going back to reading that book?
We actually, once they come out of the chamber with no headache, we say, go to school, do your homework, go to the mall and have lunch over the Christmas holiday. If you redevelop symptoms, then we haven't fixed your whole brain. So you need to come back in for more treatments. And our protocol is come back in for more treatments until the treatment that you have doesn't make you feel any better. So we kind of say it's the +1 treatment, and that you are able to be sustained symptom free.
Right.
So you can return to your academic pre-concussion performance,
Mhm.
and you can return to your athletic pre-concussion performance and not bring on a headache and not bring on dizziness or nausea, you're sleeping okay,
Mm.
then we know your concussion is resolved and you don't need hyperbaric treatment.
Mhm. Mhm.
And the kids know they are so dramatically better after the first treatment.
Mhm.
They are more than happy to come back in for more treatments.
They're not afraid probably of reporting their concussions anymore because they know that there's something that can be done.
That's another aspect that we want to study. But
Mhm.
unfortunately, I have treated patients, not in Fargo,
Mhm.
but patients who were so much better after a treatment,
Mhm.
were required by their team to see a certain group of concussion physicians,
Mhm.
and the student was told, hyperbaric didn't do anything for you, all it was relaxation.
Mm.
And the student got back in the car after that visit, and he looked at his mom and he said, "But Mom, I can still go, right? Because I feel so much better."
Yeah.
And the reason I know that story is because he came that afternoon and he had another treatment.
Yeah.
So the kids are more than willing to keep coming back in because they feel so dramatically better.
Right.
And for a physician who's not even willing to come to my clinic and watch the kids get better,
Really?
to say that it doesn't do anything, even though that physician was invited to come to my clinic to watch that student get better, it's unfortunate.
That's very tragic. I mean, that's so sad because, physicians are healers. And I mean, these days, science is changing. Well, it's been changing rapidly forever, I know. And you have to keep up with the latest and greatest techniques for healing your patients. That's why, that's why we see doctors, right, to get healed. And that's what they're supposed to do for us.
But by building the center in Fargo and coming to Fargo and working with Dr. David Bieberdorf, who has been doing eye-brain interaction and neuro-optic dysfunction, we are now able to show objectively that hyperbaric is more than just taking a nap in the chamber. And I laughed when I heard it was just taking a nap in the chamber. I thought if it was just taking a nap in the chamber, you would have nap rooms in your clinic and charge for it. But we have the objective evidence now that we need to be able to go against the naysayers. And that's exciting.
So important. Yeah. And that is so important. Well, let's see, you've given us so much wonderful information, and thank you so much for sharing your expertise and your time and your patients' time with us. It's so exciting and to know this, and I hope a lot of families and parents and students and athletes and veterans can all benefit from the conversation that we had today for the Health Foundation. And is there anything else you would like people to know? Is there anything you feel that we left out about brain health or what it means to you to support brain health? Or how can people get in touch with you if they like?
I believe our website is Healing with Hyperbarics. I'm sure if you get on the internet, you can Google. We have the clinic in Northbrook that follows my protocols and the clinic here in Fargo.
Okay.
But
Healing with Hyperbarics. Okay.
The Washington Post article and seeing that Kelly Caitlin was so hopeless for her future that she committed suicide in a dorm room.
Yeah.
And in a dorm room of a college like Stanford.
Yeah. Right.
Is why all of us keep doing what we're doing, and we keep fighting and we keep fighting and we keep fighting, because the number of incredible individuals that have committed suicide because of brain injuries, and we have a treatment, not with a black box warning, we have a treatment using pure oxygen
Right.
with pressure about the same as flying on an airplane.
Yeah.
In medical grade chambers, that we follow the same standards or better than hospitals,
Mm-hmm.
that we can treat concussions.
Yeah.
And my motto is treat a concussion.
Mm-hmm.
Let's not talk about concussion management. Let's treat concussions.
Right. Now, I should ask, are there any contraindications for hyperbaric's treatment?
If you have a history of a spontaneous pneumothorax, and that's often seen in patients with Marfan's. If you have a broken rib and the possibility of a pneumothorax,
Mm-hmm.
or if you have sinus issues and you're not able to clear your ears,
Mm-hmm.
then those are contraindications.
Okay.
You cannot go in the machine if you have an active cerebral, we call it VP shunt, ventricular to peritoneal shunt or pleural shunt.
Mm-hmm.
There are a few contraindications, but there aren't many.
Right.
The biggest thing I worry about with the athletes is the risk of a rib fracture. So if they just came off the field, we'll have them take a deep breath and see if they hurt anywhere. But fortunately, padding is so much better now than it was. Of course, with the equestrians,
Right. That's
might even want a chest x-ray if they fell off of a horse.
ahead of time.
And it's okay to be too safe.
Yes, absolutely.
We have had a few patients.
Certified is good.
Yes.
Mm-hmm.
We have had a few patients who have had a concussion, had difficulty clearing their ears to go to depth, that are more than willing to go to an ENT here in Fargo and have just a needle hole poked in their eardrum in the appropriate place so that it's not the hearing portion of the eardrum, so that they can come back to be treated with hyperbaric. Because those patients recognize that their brain is more important than the risk of a tiny needle hole in an area of the eardrum that's going to heal.
Right, like the tubes we put in babies' ears.
Correct, but they don't even have to have the tubes.
Really?
All they need is the needle hole. So it's even much less risk.
Okay.
That's what's so wonderful about being here in Fargo is people recognize how important a healthy brain is.
That is wonderful. That's a great advertisement for Fargo. I'm sure the Chamber of Commerce there will be very happy with you.
Well, if you look at USA Today's top 20 of the happiest cities, many are in Texas and California, but Fargo, Bismarck, North Dakota, and Sioux Falls, South Dakota, those three were on the list of the 20 happiest cities just the other day on USA Today. And I was fascinated. Because it may not be for the weather, as we're expecting another blizzard later tonight.
If you ever, would like to come visit us in sunny, warm Florida and tour the Howe Foundation where the palm trees are. We're doing a lot of good things down here too. You're more than welcome.
Well, after this blizzard, I may need to thaw out. I think it'll be the 4th or 5th this year.
Oh my goodness, yeah.
But it's been a wonderful year.
Yeah, that's great. It sounds like you've done a lot of wonderful things, and congratulations on all you're doing. And we're so happy to, be partnering with you with this, your participation in Brain Health Week. So thank you, and I hope you have a great day, and with all your patients and the athletes out there, and hope you enjoy your recording on Friday.
Thank you. Thanks much.
You're welcome.